BRIGHTskills. Voices of health industry professionals.
Hello, everybody, to our very first podcast episode for the BRIGHTskills Voices of Health Industry Professional podcast series. My name is Evelyn Donohoe. I am the Communications Manager for the BRIGHTskills project, and I work with Wise Angle. Today, we are delighted to welcome Katja. Katja, I'm going to ask you to pronounce your surname for me because I have problems with names. And we're also joined by Anna. So Katja and Anna work for EIT Health. Katja is a program manager and Anna is the public affairs and stakeholder manager. And both are going to be discussing the BRIGHTskills project, how this differs from other projects in the Erasmus Plus Pact for Skills health industry ecosystem, and then why is reskilling and upskilling health industries for workforces needed. So Katja, I'm going to turn to you first. Could you tell us a bit about what the BRIGHTskills project is, who is it targeting, and what does it aim to achieve?
Yeah, sure thing. Thanks for the question, Evelyn. So as you already mentioned briefly, BRIGHTskills is a European initiative which is co-funded by the Erasmus Plus program. And it's designed to address the pressing skill shortage in the health industry. We are focusing on the green and the digital transitions within the health sector, aiming to reskill and upskill the workforce to meet current and, of course, also future needs. So the project specifically targets professionals in a few health industry subsectors. So that's including the pharmaceutical, medical technology, biotechnology, and also digital health sectors. But we also wanted to put in the project a bit of emphasis on the sector which is producing personal protective equipment. Since, of course, after COVID, that was one of the sectors that was quite high in demand. The other objectives, let's say, maybe I'll keep this brief, are mapping the in-demand health industry profiles, creating a health industry future skills observatory, developing competence matrices, and designing industry-driven training programs. And with all of that, we hope that the project will enhance the adaptability and resilience of the health industry workforce.
Okay, so we hear a lot these days about the digital and green transition. It's permeating all sectors all around the world in every area of the economy. And workforce shortage is also becoming a bigger issue, but it's probably not one that we associate with the health industry. Can you tell us a little bit more about that, Katja?
So I think with the health industry, or maybe sometimes people don't associate the health industry, or they associate when people say health industry more with also the healthcare workforce. So here I think that's a great question, because we really want to make sure that we're drawing parallels, but at the same time also the important differences between the two sectors. So if we look at the health ecosystem as a whole, the healthcare professionals are typically those that are directly involved in patient care. So here we're talking about doctors, nurses, therapists, pharmacists, and so on. And the health industry workforce, on the other hand, encompasses a broader range so roles that support the healthcare system, but maybe not directly connected to patient interactions. So like I mentioned before, we're focusing on medical technology, biotechnology, pharmaceutical manufacturing, digital health solutions. So I think here a lot of profiles and roles that we have also in other sectors, not just in the health industry. Maybe the health industry is not the most attractive to individuals with those profiles. So here, let's say maybe computer experts, coding, those types of cybersecurity profiles that are not that maybe the health industry is not the first choice for them. So.
Okay. Yeah, I think it's quite important because we see more and more that there's cyber attacks, for example, happening on hospitals. And of course, you're dead right. Perhaps when people are thinking about getting into cybersecurity, they're more thinking about financial services as opposed to the health industry itself. Anna, just turning to you, Katja gave us a very good explanation about how health industry workers are different from healthcare professionals because health industry workers are not delivering the hands-on care. And indeed, when we're talking about health shortages or skill shortages, excuse me, we really don't think about health industry. We're thinking mostly about the widespread need for doctors and nurses and, of course, care workers on top of that. Why do you think Europe's health industries need a project like BRIGHTskills?
So that's a really good question. I think so. There's a great documentation. There's great background evidence on the need and the issues and shortages for the more clinical healthcare workforce. But there's also a really big, significant growing gap between the healthcare industry and more of the technical support staff as well. So I think we need to kind of think of both of these systems as complementary. We're seeing there's a huge rapid advancement in digital healthcare technologies. We're seeing a push for greener healthcare as well. There are different solutions that need to come to the market that are innovative and they haven't been thought of before. And also the AI and data analytics, that's really starting to be a thing now, and we're seeing that take over. So we're really looking for workers that are able to be equipped with the skills to tackle these issues as well. So I think that's why BRIGHTskills are so interesting. It's really focusing on upskilling and reskilling for these industry professionals to ensure we're really meeting these demands and the demands of the sector as we evolve. And again, really thinking of it as more of a complementary effort. I think when we work together from both the clinical side and from the industry side, it's really ensuring a more robust and adaptable healthcare system overall. And when we work together, the ecosystem in general really thrives and we can deliver the best care possible.
Yeah, Anna, that was dead on about the complementarity between the health industry and the healthcare delivery system, especially during the COVID-19 pandemic, where we really saw this complementarity play out. Because if we didn't have chemists, for example, develop the RNA vaccine, I mean, who knows what kind of situation we'll be living in today. Kind of linked to that, Katja, how will BRIGHTskills benefit health industry workers and healthcare services?
I mean, I think there's when the project was designed, there was a lot of real and tangible impact that was put into the project's proposal, which I think is also one of the reasons why the Commission decided to grant it. And we received really good feedback on the whole picture, let's say, of the project. So just some of the things that are in the project that we consider that will be impactful are building a critical mass for up and reskilling efforts in the health industry. There'll be an analysis of urgent and emerging skills needs in the workforce through a comprehensive, concerned, multi-stakeholder and cross-border approach, so hitting all of those buzzwords. And we will also be developing, so along with all of the partners in the consortia, an actionable health industry skills strategy. So to have a clear roadmap for expansive implementation of talent developments, and therefore this can be driven both on regional, national, and also European ecosystems. There also will be designing and piloting training programs through innovative pedagogical methodologies. And along with that, we have partners that are working on the certification and accreditation of those training programs. So because we know that in the current market, job market, that's something that's important to a lot of job seekers, but also employers.
Mm-hmm.
Yeah.
Yeah, and I suppose because we are training up health industry workers in this way, it means that more innovations can come to the market, hopefully a little bit quicker, because we also have the competitiveness strategy at EU level, or the competitive compass. So it really means that hopefully at some point when the internal market barriers are broken down, that these SMEs, for example, in the medtech sector, will have the workforce they need to bring their innovations to scale and also to a wider audience. So kind of again touching on that topic, Anna, there are a lot of changes happening in the healthcare sector at the moment. How are they impacting health companies?
Great question. So there are several changes happening. Well, there are a plethora of changes actually happening in Europe, but also happening in the healthcare sector. I think European health companies are really struggling, or they're trying to navigate a landscape which is marked with like rapid digitalization. We're seeing an aging population. We're seeing increased environmental concerns and the green agenda as well. And then there's also the fact that we're striving towards digitalization, health data, more sustainable practices as well. And then on the innovative side, we're also seeing personalized medicine coming up and so many new innovations. So I think all of these challenges in total are really shaping operations for different healthcare companies. And we see this necessary shift towards having a workforce that's more adaptable to these new technologies, adapting to these new changes, because you never really know what's going to happen next, because the world's always and constantly ever changing. I think companies are investing and reinvesting in training and development. I think it's also important that they are investing to remain competitive. And also they're trying to meet the regulatory requirements that come out of all of these shifts. So new policies like the EHDS requires a lot of things that companies need to put into place in order to really meet and adapt these changes. So yeah, it's always ever growing, and I think companies are always working towards improving themselves.
Yeah, and I think you kind of touched there on this flux that's constantly happening at the moment. So just before COVID, there was a huge emphasis on the environmental aspect, and we see that kind of slowly dropping off the agenda, and all of the chat, as we like to say, is focusing on AI and digital. Where does the environmental aspect kick in for companies at this point in time? Is it as important as what it was a few years ago?
So I think future-proofing is always incredibly important. I think we see a real shift towards the green transition in general in Europe. So I would say, yes, it's definitely important. I think the digital and green transitions can be looked at together, like digitalization can really support greening and greening the other way around. So yeah, I would say it continues to be important, and whatever the future holds, it's always very important for companies and the whole ecosystem to take this into account.
Okay, perfect. And staying with you, Anna, how important is the health industry for Europe?
So the healthcare industry is incredibly important for Europe. I'd say it's one of the cornerstones of Europe, the cornerstone of its economy, and also the public health infrastructure as well. We're seeing that it really significantly contributes to GDP, but also employment as well. The healthcare industry employs a lot of people, and it's really playing a crucial role in supplying tools, the technologies that are really essential for healthcare delivery. So when we look at what the industry produces, they're producing medical devices, pharmaceuticals, they're advancing digital solutions, they're supporting really the entire continuum of the healthcare. So for patients, it's really important. It's driving innovation as well. So it's looking at the improvement of patient outcomes, it's looking at efficiency, the overall quality of healthcare services. across this continuum and also through the continent as well. So that's all the patients, citizens as well. And then it goes back to what I said in the beginning about this complementarity between clinical healthcare and also the healthcare industry, that we always need to be working together, because when we work together, we really thrive.
Yeah, and I think it's also very easy to forget just how dependent we are on medical technology, for example, because there's such things as like medical stethoscopes for medical supplies. It's the surgical gloves that the doctors or nurses are using on a daily basis, and even blood pressure monitor machines. So we kind of know about the pharmaceutical side because it's something that almost all of us use on a very regular basis, but we think less so about these, the medical equipment and digital health side, unless you're using a Fitbit, of course, then you're probably very familiar with it. What's really interesting, of course, is that there's almost 24 million workers in the healthcare sector, and that encompasses healthcare delivery and the healthcare industry. And in healthcare industry, of course, we're also talking about companies as well. And those 24 million workers are very diverse. So we have workers who are just entering into the workforce, and then we've others coming maybe towards the last decade, the last 5 years of their working life. What message would you both give them about engaging in training and development, considering that they're probably looking at these opportunities in very different ways?
So I would say the same thing that my primary school teacher said to me, which was that you never stop learning. No matter where you are in your life, you're always continuously learning and improving and being part of society. So I think it's one of the most empowering things we have in today's work environment, that especially in the healthcare industry, your learning just doesn't stop at any age. Whatever age you are, you're always developing. So for those of you that are starting out, I would say it's really important to have a good foundation, having these skills and evolving and taking the time to learn these new skills is always really important. And it really helps you enter the healthcare workforce and adapt as we go on. And then I would say for those which are more towards the end of your career, it's amazing the things that I learned from people towards the end of their career. Like, I think it's really important to keep learning and adapting, because when you're learning, it's also about connecting, adapting, and really staying up to date with the new concepts. And I think that's always an important thing to have in your life.
Yeah, I totally agree. There's some mentors I have, and they say some things even about their personalities, and it's like, oh, that's not just me. Actually, it's normal to be like this and to be thinking like this. So it can also be reassuring when you have this reflection coming back from somebody older and more experienced than what you are. And Katja, what about you? What advice would you give to these people?
I'm not sure I can top Anna's answer, which started with such a perfect memory at the beginning. But no, I mean, I think it's always important to learn. It's you can not just in the health industry, in all aspects of life. I mean, I think if we look at older generations who, and here, I mean, we're talking a lot about digital and green. If we look at older generations who, I don't know, I sometimes think my grandparents who now use iPhones and tablets and computers, and probably when they were growing up and when they were working, they didn't have any technology. They had maybe a small calculator and that was it. But they have evolved, because I think for those who are maybe towards the end of their career, it's not just to keep growing in their career, but also to stay in step with society. I mean, Anna mentioned the European health data space before. It's not just something that if you are in the health industry that you are working with it, but also later on you will be impacted by it. Maybe as a patient or someone that you know will be impacted by it. So I think that's a that's a great example. And for those entering the workforce, I think it's a no-brainer to continue learning, to seek out employers who value that, who will invest into your learning and your development. So I think that's also an important aspect of all of this.
Yeah, you're dead right, because we also have the Work and Health Foundation report, which shows the benefits of intergenerational knowledge sharing, let's call it. So for the older workforce, it might not come to mind that you could possibly be a mentor, but actually you will have younger colleagues who do look up to you as a mentor. And I suppose if we think about the electricity breakdown in the southern part of the continent just last week, the importance of having skills like using a calculator somehow suddenly increase in importance when you least expect that you need them, and you think these skills are going to become obsolete. And then, of course, for our listeners, one of the benefits of BRIGHTskills is that the trainings that we will develop, they will be industry informed, because we will really be seeking employers' feedback into what skills they need from their workforce. So that will improve your employability and your chances of accessing that kind of dream job that you want. And of course, for people who are mid-career and later career, maybe you're also reflecting and thinking about what legacy you want to leave just as you exit the workforce. So of course, those trainings will also help you to reflect on that and maybe help you achieve these latter end career goals. So Anna and Katja, I want to thank you very much for joining us today. That was very interesting, and I hope our listeners will enjoy listening to your expert opinions and views. For our listeners, we are on X and we are also on LinkedIn. The podcast will be available on Spotify and uploaded to YouTube. So please follow us on those channels, and if you have any questions, don't hesitate to put them into the boxes below those channels, and we will do our best to address them. So again, Anna and Katja, thank you for joining us today, and I hope everybody has a good week and a good month ahead.
Reskilling. Voices of health industry professionals.